it can be hard to explain what to feel for when you're working with scar tissue. So I like to use lots of different techniques to try and get the attendees on my courses to try and understand what they should be feeling for and why it feels like that. So one of the tools that I take along to some of my courses is a scar that I've made that I've put in a box. My current scar has been damaged by overuse, too many people playing around with the plastic, which works as the skin. So I'm just going to make a new one. And I thought it might be interesting to kind of document what I'm doing and why I do it. So when I'm working, and I use an example of a C-section scar because 1 in 4 births in the UK are C-section, so it's a really great tool because it's something that most of the therapists that I teach are going to come across at some point or another. So what I need is something that feels soft like a tummy. So this is a lovely bit of packaging that came with a food delivery box that I got. So it feels really nice and soft and a little bit springy, which is what you'd expect if somebody's had a baby, that their tummy, and it's normal for the stomach to have adipose tissue on it. And then I'm going to be using this kind of quite thick fibrotic piece of kind of woven ribbon, which will demonstrate what the scar line feels like underneath the tissue. So it could be a scar that looks absolutely perfect on the surface and hasn't got any ridges or bumps right on the surface of the skin, but what's happening is that in the deeper layers underneath you've got quite a lot of fibrotic tissue, because when you work with scars, and I talk about scar work, people will quite often think about, well, my scar looks fine, on the surface it's a nice thin white line, but that's not what it's about. What we're treating with scar work is the thickening and the possible lack of connection that's happened underneath. And this is going to be what I call the kind of spongy void that sometimes occurs where you've had a scar that's been held open for a while because the surgeons obviously needed to get access inside, and then sometimes there's quite a lot of dabbing with swabs to keep the area dry so that they can see what they're doing. So the tissue that's been lifted up gets quite kind of traumatised on the underneath side, and as it's then put down and then the inflammatory process starts as a natural part of healing, that all gets kind of stuck together. And then what should happen in normal scar healing is that you get something called granulation tissue forming in the void in between the two sides of the scar tissue before they get pulled together, which is obviously not got the same strength and integrity of normal tissue. And so this is going to be my granulation tissue, because with some scars what happens is the two sides of the scar where you get the granulation tissue forming in the kind of triangle in the middle, then later in the scar healing there should be lots of contractile factors happening within the body where the skin underneath the skin, the two layers are being pulled together, and sometimes that doesn't happen effectively enough for one reason or another. There are many factors that can affect scar healing, and so what's left then for the therapist to palpate is a layer of fibrous tissue, then a layer of very spongy kind of, and it's very tiny, you know, we're talking about less than ½ centimetre. If you laid your finger along the scar line, what you get is a layer of fibrous tissue to one side, a real sense of kind of spongy dropping in the middle, and then a layer of fibrous tissue on the other side. So I'm going to be stitching all this onto this matting, which is the rest of their tummy, and then this is going to be the skin, which is going to be moving very nicely because this person hasn't got adhesions all the way up to the top of their skin. So it will make it then harder for my therapists, because I'm then going to put this in a box and they're going to have to go in blind. And then hopefully as they feel around, I can then talk about what it is I'm feeling for, and they'll get a sense of what to look for with their hands, what to feel for. But anyone who's got a C-section scar can also have a good exam on themselves and see, is that what my scar feels like? Because if it does, what we can do with scar work is really help to soften those two sides of quite hard fibrous tissues and encourage the body to get those two sides to rejoin, even if it's a long time after the surgery. Let's get started.